why does equity, diversity, inclusion matter to me? I think it's from my lived experience. I had a tough time at medical school where I didn't feel like I belonged in that medical school. It felt like there were these cliques, these bigger groups where everyone felt like they belonged, they could contribute to everything. I was on the periphery with my friends and colleagues as well. And I thought, what kind of an experience is that for medical school? So I always wanted to make that change. And with colleagues like Elora over the last 13, 14 years, we've been trying to make it a more welcoming place for our students and for our staff as well, because the literature suggests by creating an inclusive learning environment, you can get the maximum benefit for your students and staff and enhance the environment and the learning from that as well. So we're trying to push away from just equity, diversity, inclusion though, to justice.
Well, I carry a few protected characteristics myself. So it's always been something that's been really fundamental to my own identity and therefore the way that I teach. But really more than that, it's about really wanting all students, whatever baggage they carry, to have as much a right to progress and succeed as anyone else. And that for me is a really core belief.
So you might be wondering how this EDI committee came to fruition. What's the history of it? So the bottom line is I've been involved in medical education since about 2009, 2010, quite involved in it. And over that period of time, a few of us realised that there were there was a lot of inequity, a lot of injustice, a lot of lack of inclusion, particularly in curricular content. So we were looking at problem-based learning, PBL, cases, we were looking at other aspects of the programme, but a small group of us were doing it on an unofficial basis. It wasn't anything recognised in the programme. So it wasn't until the murder of George Floyd, when EDI came to prominence, the issues of inequity, of injustice came to prominence, that we took that opportunity to start talking to the medical programme and the senior colleagues in the programme about this. And what we were able to do was to develop a strategy, working closely with my then co-lead, Dr. Rebecca Farrington, in creating a workable strategy. And using that strategy, we were invited to join programme committee as a standing agenda, and it enabled us to create an EDI committee to be able to discuss and plan ahead in terms of our EDI activities.
So alongside the staff training that we as a large team have developed, we've also put together, again very much as a team effort, some training for medical students. So this will be mandatory training for all students that travel through the programme, and it's around being an active bystander. So for those of you that aren't aware, what that means is if you notice a discrimination, or if you notice something happening in an environment that's negative or has a negative consequence on the person who has received that, then it allows you to intervene in a way that feels safe and appropriate. Students often feel like they're the bottom of the pecking order, and so it's really important that they feel empowered to raise concerns when they see them and to know how those concerns are escalated and have a bit of an understanding as to the processes behind them.
Our Muslim students for many years have been saying that when they come to medical schools, they don't have sort of like a steer of where to go, where to get support, where the prayer rooms facilities are. So our students actually approached us and said, can you support us in creating a guide? And we created the Manchester Muslim Medical Student Guide with the help and support of the Muslim chaplain and also the medical programme, who helped review and guide us in terms of the information we provided. So we provided information on prayer facilities, on festivals, on how to liaise with the programme on that. And it was so well received that the General Medical Council and the Medical Schools Council spoke positively about it. And it resulted in over 10 medical schools nationally utilising the expertise of our student team to create their own versions of Muslim student guides.
So our student committee have been really active and over many years have worked hard to look at the medical programme teaching materials to decolonise them. So examples of that include ensuring that there are images representative of lots of different skin colour types, looking at ethnic variations in health outcomes like mortality in maternity, and also removing things like negative stereotypes and putting in more positive examples to counter things like heteronormativity.
I think what we want to create is an EDI positive medical programme, which we can really be proud of.